Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And today I'm absolutely thrilled to welcome Dr. Hans van Lancker and Geoffrey Hall. Thanks for joining us today, Hans and Geoffrey.
Thank you for having
Thank
us.
you.
It's great to be here.
Okay, you're welcome. And by way of a very brief introduction, Dr. Hans van Lancker is an orthopedic trauma surgeon and chief of orthopedics, rheumatology, physiatry, and rehab. And Geoffrey Hall is an experienced hospital CEO and advisor. And today we'll be talking about how Olivia Morris and I are working on connecting and amplifying healthcare leaders who are making a positive impact. And she introduced me to both of you and would like to hear your views and vision on creating positive culture at work and how to make community hospitals sustainable. And one reason I'm really thrilled for this episode is, as I think we all know, lots of times there's friction between C-suite and physicians, right? Physicians think that C-suite doesn't care, and C-suite thinks that physicians don't understand the pressures they face. So, but at the end of the day, as Dr. Kevin Poe said when I interviewed him, we all want what's best for patients, right? In the end. So to share your perspectives and amplify that we're on the same team and share your views together, I think is priceless and so important. So that's one reason I'm just thrilled to have you both on together. And I always start by asking what you'd most like our audience to know about you. Hans, would you like to go first?
Sure. Um, let's see. Yeah, I'm obviously an orthopedic trauma surgeon, so I like fixing things. And every opportunity that I see and have where there's something that's not working well, I can't help but want to try to make it work better. And healthcare, especially how healthcare work, needs to work together. And I think, Jeffrey and I have had the opportunity to speak a little bit before this, and I think that friction doesn't exist already between the conversations that we've had. But I finding the ways to make things really come together and be sustainable are what excite me, right? And it can be in the operating room with, one making that day work more efficiently or making the surgery, happen to the best possible outcome, with keeping everybody happy in the process, to, figuring out how to make a hospital actually work so that, it provides what that community needs and is, really a pillar to the society there. So I I I look forward to it all on a daily basis. So
Well, that's great. And Jeffrey, what would you like to share?
Yeah, so I've had the opportunity to work and lead healthcare organizations for more than 20 years. And the more I do it, the more I realize it's about the people that provide the care. And my background is kind of unique to administration. I come from a social work background. Um, Certainly, have had all the business training and healthcare leadership training. Uh, but that social work training of putting people first and really building trust and rapport, I think, is really what creates the best outcome. And everyone in healthcare will tell you that they're patient centered. But in my experience, you can't really achieve patient outcomes and patient satisfaction until you first empower your clinicians, your physicians, to really be engaged and have an empowered, supported experience, and that creates the excellence in the patient care and the patient satisfaction. So, really looking forward to this conversation today.
Yeah, well, that's terrific, and I fully agree. And Hans, I've had a conversation with each of you before, and you shared the ways you've been able to do that as a healthcare leader with your own team. Would you like to talk about how you've been able to do that and make it sustainable for a community hospital and what you're working to do?
Yeah, sure, absolutely. And I just to, reinforce some of what Jeffrey said there too. I think, Jeffrey, that's why you've been so successful in the way that you've led, right? And having that perspective and taking the ability to step back and look at you know, what are the needs of the people that provide the care, not just, sort of enabling them to be able to be productive, but also sort of enabling them to be sustainable in their jobs and enabling them to feel like this is a place that they want to continue to work because they have the resources that they need, that they're valued in ways that aren't just financial. And, that it goes so far. And I think just it resonates with me that you said that, and and that's the perspective that you come from, and that's a lot of what it is, right? A lot of what it is paying attention to and listening to the needs of the people that I work with. And that can be, well, how do I incentivize them to feel like the mission of the institution, both the financial mission and the ethical mission of the institution, are aligned with them and the work that they do. So, we've created some really novel incentives that have, enabled people and empowered people to think about cost because they're actually going to receive a benefit when they decrease costs. And I think that that's the key to value-based care, right? Is not this sort of race to the bottom, but it's how do I enable people to make that part of the decision making that they're making in work every day. And that can be through, some things that I know CHA has done really well, is HCC coding incentives. So capturing those high complexity codes, you know, and then in the operating room specifically is the gain share incentive that we designed and actually wrote up with Harvard Business School, where a certain portion of the savings in the OR go back to the physicians and back to the department, and that can be for reinvestment and incentive, et cetera. So, and then it's about the environment. The other thing that I think is so important is creating an environment that people want to work in, and that's both a physical environment and a cultural environment. And, so always having eyes on those and making sure that there's good resources and good food and good benefits and all those things are so important to keeping people engaged. So that's where I like to start.
Yeah. There's so much power in what you just said because what you're really talking about is elevating the physician input into the real key decisions and the leadership of the organization. And I am constantly reminded as a CEO, and I think it's a good reminder for all of us that CEOs don't admit patients and they don't discharge patients. And my job, if I'm being effective as a CEO, is to take on all of those administrative burdens and barriers to my medical staff and my clinical staff just providing great care. And if I can like smooth out the road administratively, then people are at their best and healthcare becomes again a satisfying environment where it's not just about productivity and a situation that creates burnout, but we're back to the reasons why we all got into healthcare, which is we wanted to help others and we wanted to make a difference. And so sometimes I think CEOs fall into the trap that they're responsible for the budget and they're responsible for the operations of everything. But when you're able to partner with your physicians and your medical staff and your clinical staff, the most frontline staff is going to be able to give you feedback about what creates stress, where do they feel pressure, and what actually fills their cup. And for me, I think to be successful, you can't get too far away from the people that you serve. And my best advice for any leader in healthcare is never stop rounding. And
Mm.
you need to do it at bedside. You need to do it at point of care. You need to do it after the patient leaves so that you're listening to the transitions in care. And that's what helps me improve the organization and create a culture that reinforces something that is a place of healing and health, not just burnout and frustration.
I love that so much. Every single thing, right, that you both said. And I think Hans and I, well, I'll speak for myself, want to give you a hug, right? And that's so true that it is all about the people who provide the care and that physicians need a seat at the table and that you have found ways to do that. And I recently interviewed Dr. Apurv Gupta. Are either one of you familiar with him? He's started a nonprofit, a loving organization, and he's found healthcare systems in nature, he would say, like you, Jeffrey. So I have to connect him with all, with you guys when we're done. I have to connect you all. So he's also trying to build that and saying exactly what you said. That's where we need to start. And there are organizations doing that. And he listed them. I just shared our episode, and I think one was in Hackensack. There's some in Florida. So he listed at least 10. So there are other, C-suite leaders and healthcare leaders out there like you, Jeffrey. And what would you say? Because I mean, I think in general, well, like sometimes doctors work themselves up to being the C-suite or to being the CEO of hospitals. And sometimes other people say that they like forgot where they came from. So sometimes I know part of it could be that we don't understand the stress and pressures they face, but obviously you have experienced a ton of stress and pressure. So how do you actually make that happen? Like, what would you say to leaders who have become maybe numb to it all?
Well, I think one of the things that I like about the work that Dr. Van Lacker is doing is he's balancing the innovation and a vision for the future with the day to day, and he's bringing people to the table, and he's having real discussion around how it can be better. And I think as CEOs, and leaders, it's really easy to get into an echo chamber where you feel like because you've got so much experience, you've been there, done that. And my comment about never stop rounding is that point of um, your outcome is only as good as it's meaningful to the patient in front of you, and to that patient, to that family, they're going through one of the biggest things in their life, and sometimes it's a traumatic accident, sometimes it's a stroke or some other event. But if we allow ourselves to become numb to what that means to that patient and what that means to their family, we're really missing that. And there's so much pressure and so much extra noise in healthcare that really it just starts with kind of getting back to the basics of being the most humane and most human environment. Right now, healthcare is just being, there's so much proliferation of artificial intelligence and this need for technology to create efficiency. And all of those things can be good, but where it's best is where it's optimizing those workflows, it's making the environment less noisy. So the clinicians at the top of their license and the top of their training just get to provide compassionate, advanced clinical care. I'll never forget what one of the physician executives that I worked alongside with and partnered with. And he had a very simple formula he had learned in medical school, and it was to be affable, available, and let your advanced skills show. And by following those things, he was a world class physician, and he was um, industry leading. He was building world class reputation. The rankings of the department was matching just a world class destination. And he was so humble in the fact that he needed to be kind of nice, he needed to be available, and that's where his skill would come through. And I think that's the recipe in medicine that makes us trust and want to come back to you as a physician and as an organization, and not just be about the productivity or the budget or the margin and all of those things that just get noisy.
I love what you said there with, the affable, available, and able, piece. I think that's something that it's ingrained in my mind, and it translates to, success in so many places, right? It also translates to success in a leadership position, right? Being able to be nice and be, available to work through a problem and listen and able to then fix that problem, are the key parts of getting it right. One thing that I think, you mentioned that stood out was when we look at technology, when we look at AI, when we look at, the things that are moving quickly in the evolution of healthcare and how to integrate, what's going to be good there. And then I think there are a lot of things that will be very good. And there are some other things that, some have already failed because they weren't designed so well to actually do exactly what you're talking about and give the physician more time to spend with the patient on the humanistic part of medicine. And I have a personal example that I think is powerful in that we were one of the first institutions in Boston to bring in an AI scribe. And what I knew that I was really excited about with the AI scribe and what has proven to be both, a clinical benefit and a patient experience benefit and an economic benefit is that, the AI scribe listens to the interaction that you have naturally, and then it documents based on what it hears. And it's become more and more accurate and more efficient at being able to do that. And now I am able to sit down, have a interaction with a patient without worrying about my documentation. And actually, it's hearing more than I could recollect, in the time that I have after clinic to write the notes. And it's made me more efficient so that I can see more patients, but have more of a humanistic relationship with them when I do see them. And I'm happier because when I'm done with the day, all of my notes are finished, and then they can all get billed quickly, and we don't have a problem. And it's done that. And we were one of the first institutions to implement it sort of across the entire organization. And it's stuff like that that we need to find, right? And there's more out there, and it continues to grow. But those types of tools are so powerful because they allow us to be better doctors and be more efficient and provide higher quality, more complete care. So
Well,
just
I'm so glad that you said that because I don't think the world talks enough about the workday of a physician, and the physician colleagues that I've had over the years. Um, they're always the first to arrive and round on their patients. They're busy throughout the day. They're going back at the end of their day to check on the patients that they're concerned about. And this is not even counting the calls that they receive, or the um, just the workload that's built into their day. And then they go home, and from like 8 to 11 p.m., they're writing notes, trying to capture everything that's happened through the day. And it just creates this cycle. Everyone now talks about work-life balance, but the we're getting better at the work-life balance of a nurse or a therapist or hopefully a case manager, but we need to include physicians in that conversation. And that's why I'm so excited to see some of the artificial intelligence coming, because if it creates a better flow for that physician, allowing them to spend more meaningful time answering questions, given reasons why this intervention versus that intervention, and letting patients and families feel connected, to the outcome. That's that's where medicine needs to go. And the ambient listening, the artificial intelligence, the stuff that reduces the noise so that you can be your best clinician, that's what I'd love to see more of. I'm not a fan of, as a CEO, of artificial intelligent solutions to a problem that I don't have, and how they sometimes start conversations with, it's going to eliminate all these positions. Well, I don't want to eliminate my staff. I just want to repurpose them so that we're more humane in what we're doing.
right, right. Enable that top of license experience for, for everybody, which then leads to better satisfaction on the patient side. And, and you get, as a leader, the CEO, you get the outcome that you want through empowering the people that you work with, right? As opposed to, you know, telling them that you need them to reach these goals, they'll start to get there anyway because
Yeah.
they've got the tools to do so.
And when you do that, you're reducing so much of the hidden cost of turnover and recruitment, and then the cost of training someone up to your quality standard. if you can just create a better environment, then like you said earlier, it's an environment where people choose to come, they want to stay, and they're going to grow with you. And when they grow with you, sometimes it's not it's growing deeper. So you can set a bigger target and a better quality metric, and it turns you into a top performing organization when people and purpose become aligned around that.
Absolutely. Yeah, and it makes
100%. If it's okay for me to step in for a minute, I love the practical examples you're sharing, and I love that affable, available, and letting your advanced skills show. And that dovetails. I recently had on Bob Berg. He has a book series, and one's called The Go Giver, and he had shared things about autonomy, connection, and competence. And it wasn't in relation to physicians, but in the episode, I spoke to that relating it to physicians. So I feel like those are three main things as well. If we could just restore physician autonomy and also about connection and relationships and competence, like when you get a new AMR, temporarily physicians can feel incompetent, right? Or there's that imposter syndrome and things like that. So I feel that those three things are so important. And relating to physician autonomy, I think that's some of the reason for the moral injury when you can't do and me as a physical therapist once the EMR came, right, and you had to be sitting there with the computer in front of the patient, and or when they were telling me how long I could see a patient based on their insurance, right? And if they were on Medicaid, I could only see them 30 minutes. It could be a 50-year-old who just had a knee replacement, but that only let me see them 30 minutes. But then if somebody had better insurance, it could be a 90-year-old woman on oxygen and then make me see her for an hour and 15 minutes because we could bill for it. And I'm not exaggerating. Like those are two examples that I can think of. So I'm wondering what you would like to speak to about how a lot of things I think could change and be solved right now if we can find ways to restore physician autonomy and amplify those connections and relationships at all levels.
I'm going to defer first to Dr. Von Lancker to get his thoughts on autonomy, and I'd like to add to that.
so, I think the key, so they've made it really hard to be in private practice through, the way the insurance companies works and the way that things are reimbursed. And there's been some opportunities to create, microcosms where it can work. And that is one way to achieve autonomy. That said, you are then beholden to sort of your bottom line running a practice. So I'm not sure that that's quite the best path to autonomy either. I do think that, we need to look at future opportunities around continuing to grow the ways that people can feel like they have some ownership of where they work, right? So I think there are great examples of this in the tech world, and it can be um, through incentives, it can be through the the resources and the environment that you're enabled, you can work in that can be really special, and you don't want to leave, and you feel like you're connected to that. It could be through the people, through the culture, right? We have to pay attention to all those things to make providers feel that they are making the decision to be where they are and contribute to where they are. And I think being creative there is important, right? Looking to outside external industries to get ideas around how can we do this. With regard to autonomy, so much of it is determined by insurance in some ways with regard to decision making, right? And I think that's where there is opportunity to think differently too, in that, there may be a better structure to the way that we deliver care and the way that we account for the cost of care that better involves the physicians, in the ownership of that decision making. We've seen a lot of examples of this through, bundle payment, through there's a new model, coming to be in orthopedics soon as well. Some of those have been a race to the bottom, which have actually sort of in some ways almost disincentivized you to be thoughtful, because then it just made it harder for you to make any margin on the procedure that you're doing, um, and be able to even pay for itself. So I think we have to be really thoughtful about how we do that. I think, where we can be creative is if you look at large large companies, large industries, they have an opportunity to think differently about how they insure and care for their entire cohort of employees. And partnering with health systems that want to do that differently, I think is a real opportunity to evolve the way that, insurance could work in a way that might be more sustainable and might make the physicians who are such an important part of the cost and decision making feel like they're a part of that. And that's where, we need to find ways to give people ownership again, right? I mean, there's laws right now that prevent us from owning a piece of the place that we work. It's really the only industry that has that issue. Like any other industry that you work within, the people that work at the company can own part of the company that they work within. You can't do that in healthcare. Like you're not allowed to own part of your health system. So, you know, I think that's thinking differently about how to make that work and, which is going to necessitate legislation and thoughtful reorganization of those things is where we need to go over time.
Yeah. I just thinking about all of that and what you're really describing as physicians being involved in the business and having real discussions around some of the metrics and drivers that make the business work. And I think there's been a trend in healthcare where physicians have not been involved in some of those conversations. And I think bringing them to the table is going to be key because it impacts policy, it impacts the direction of the hospital. And for me, as I was listening to that, um, the word that kept coming back to me was just building a consensus. And you have to have a consensus of what your identity is going to be and who do you want to serve and how do you best want to serve those individuals. And I think that's so true for a community because you're building a community within the organization, but that organization exists externally to serve a larger community. And I think bringing physicians from a healthcare leadership CEO perspective, bringing physicians to the table to build your strategic plan for the next 5 years is so important because in those brainstorming discussions around what your strategic plan should be, you start to create that identity. And then once you have that identity of where everybody wants to go, the autonomy flows easily from that because you just trust people to execute to this larger plan. And for organizations that are struggling in their culture and struggling in their retention and struggling in their quality outcomes, I would bet they're not having real brainstorming conversations involving with inclusion people at the table around a strategic plan because you get so caught up in the day-to-day operations that you start counting reflectors rather than looking out to the horizon where your headlights should be pointing. So I think what Dr. Van Lancker is saying is physicians need to be involved in the business. And I completely support that. I think as healthcare leaders, particularly someone who is non-clinical, I'm never going to be the best pharmacist or the best nurse or the best physical therapist or the best physician. My job as a leader is to bring out the best in that environment and let those people be their best. And if you do that, then you're staying true to your mission and you're serving your community.
I love all of that. And again, it all comes back to culture, right? And culture transformation. And the two of you are sharing excellent examples of how to be healthcare leaders. And if you are a healthcare leader that's struggling, people like you are out there that can help. And that's why we need to amplify these voices and messages. And I believe we're going to have a follow up to this conversation. So when we're done, you could take some notes on things you want to talk about in the future. And as we start to wind down, I'll give you each an opportunity to share any final take home messages that you wish to share and how our listeners can get in touch with you.
Sure. So, first of all, I just have to acknowledge the work that you're doing, Kim. And I follow your posts, I follow your podcast, and you're such a unique and powerful voice standing up for doctors. And I think that's a really important thing. And I would encourage everyone in healthcare that just to be aware that healthcare is not easy, and we all know that. But we as leaders and people who are really interested in making a difference, we're being challenged to care for the people who care for others. And I think there's some real meaningful ways to do that. It doesn't mean we have to abandon technology or that we can't implement the newest innovation and artificial intelligence and deal with insurance companies and all of those things. But if we keep the patients at the center of what we do, and we know that to deliver the best care to those patients, we have to start with those caregivers and those clinicians and those physicians. If you do that, then the business will take care of itself. And just really applaud the work that you're doing. And I always enjoy my conversations with Dr. Van Lancker and just really enjoy his perspective on the innovation and the physician engagement and alignment that he's creating. And it's just been really great talking to both of you.
Well, thanks. And if our listeners want to follow you, how do you recommend they do that?
The best place to do that is on LinkedIn. I try to be a real person there. So if you send me a message, I'll try to follow up and try to say yes to meetings and just make myself available in the spirit of helping others.
Okay. Well, thank you very much, and thank you so much for all of your work, Geoffrey. And Hans, any final take-home messages for our audience and how our listeners can get in touch with you?
Thank you, Kim. And thank you, Jeffrey, for the kind words. Kim, I have so much respect and really appreciate the selfless work you're doing here, and I'm very grateful to have been able to talk a little bit today. I I think the thing for me that I continually go back to is that the state of healthcare right now is one that needs to be fixed, and that's that's something that can be daunting and at times frustrating. And I know it's led, colleagues of mine out of healthcare. Um, and but I see it as a really big opportunity. This is the opportunity for us to get it right. This is the opportunity for us to think differently about how we can make all these pieces work together, centered around the patient, just like you said, Jeffrey, and create an environment where things actually move forward. And I look at other industries that are inspiring to me. Short story, I very much wanted to be an astronaut before I decided to want to be a surgeon. I have not totally given up that potential. We'll see. Um, that said, the way that NASA and space exploration accelerates technology has always been something that's been very inspiring to me. We need to get healthcare to that level. We need to get healthcare to the level where that industry accelerates technology because there's so much energy and emphasis and positive outlook on where it can go. And that's what I want to continue to foster and bring to it and see happen and make more people want to be a part of it because it's where the future lies.
Well, that's great. And how can our listeners find you?
LinkedIn is great. You have my email, Kim. Feel free to share it. I'm always willing to have another conversation, grow my network, and try to, in order to fix something this big, we need as many people as we can get that want to do it. So, all for it.
Okay, well, sounds good. So maybe we'll have to have another conversation and include our friend Olivia Morris. And this
Yes.
might just be the very beginning. So thanks again for being my guest. I think this is such an important conversation, and I love Geoffrey speaking about human, Hans speaking about an opportunity to make things better. So just thanks again. I love the work that both of you are doing as well.
Thank you.
Thank you, Kim.
You're welcome. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.